thought today I would come on and do a little video and answer some questions. First and foremost, I want to put a disclaimer out there to state that I am not a medical professional. I can only base my videos off my own personal experiences and off what my team have told me to do. If you do things differently to the way that I do things, then that is between you and your team, and I'm not here to tell you you're doing it wrong or that you're doing it differently. At the end of the day, different areas, different teams tell people to do things in different ways. So I can just answer for myself. I can't answer for everyone. So I just wanted to put that out there. I do have some medical knowledge, but obviously I'm not a medical professional. I'm not trained as a medical professional. So I just wanted to put that out there, that, you know, this is just my personal experiences and what I do. So don't think that it's okay for everyone to do these things. Always consult your teams and your medical professionals who work with you when it comes to your feeding tubes, and there are different variations of feeding tubes as well, so what may work for one person may not work for another. So I just wanted to put that disclaimer out there. Nobody who does things like deals with feeding tubes and things like that does things in a wrong way. It's just the way that they've been told to do it by their team, and the same applies for myself. So, questions. One of the questions that I get asked most is, why do I need a feeding tube? Well, if you follow my Instagram or my YouTube, or you follow me in general, you will know that I have a condition called gastroparesis. Gastroparesis is basically what it states. It is paralysis of the stomach. Some people have full paralysis, other people have partial paralysis. I have very long delay with my stomach. It's not fully paralyzed, but it is extremely delayed. So a normal person's stomach on average, who has normal digestion, would, with a small meal, say for example 1 scrambled egg with a couple of pieces of bread or toast and a small glass of water, something like that, which is what you would be given for a gastric emptying study, would normally digest within 2 hours. 2 hours is usually the maximum time that somebody's normal digestion would work, and you would normally by that point see 95% to 100% of food that has been in the stomach emptied out and into the small intestine by that point, and that would be classed as normal digestion. And this is based on adults, not on children, who may have a slower or faster rate of digestion. This is basically just on somebody of my age group. Obviously everyone's different, so some people may take a little bit over the 2 hours, but on a guideline it's around 2 hours. For me personally, I take a way over 4 hours to digest that tiny little portion of food, which means that I have what's known as a significant severe delay with my stomach emptying. Since my gastroparesis diagnosis, my stomach has actually deteriorated worse, and it does take me up until probably about 36 hours just to digest a oral laxative tablet, because of the fact that it doesn't get into my system as quickly as it should. So it can take a while for things to digest. I had soup at one point, and 12 hours later I was draining it because it was just making me feel really sick. So yeah, that's basically why I have a feeding tube, because anything that I eat orally will sit in my stomach for a long time and it doesn't digest as quickly or as normally as it should. So next question was, how often do I have my tubes changed? Okay, so this is my first PEG J tube. Originally I was on a nasal jejunal tube, and my nasal jejunal tube was given to me in April of 2021, after 2 years of fighting with doctors about things going wrong with my digestive tract. They gave me my tube and it stayed in place for 6 months. Then the doctor decided it was time to remove the tube and hopefully I would manage without it after giving my stomach a rest. Unfortunately, this did not happen, and I lost a shed full of weight and pretty much all of my body's muscle mass. which I'm still even now trying to build back up again. I then had a change in GI doctor. Despite the fact that I needed my tube back, I wasn't given it, which means then I lost even more weight and even more muscle mass. So by the time I got my tube back, it was May last year, and I ended up with my tube back after, I think it was 5 or 6 months without my tube, if not more, which obviously was detrimental to my health. The doctor took one look at me and looked at my medical history and was like, yeah, we need to give you your tube back. And within 4 days, I had my tube back in my face. So yeah, that's just pretty much how bad my stomach is. And I had that tube in place until I think it was September, and then I started bringing my tubes up, and that wasn't fun. So in total last year, between last year and the time I had my PEG-J placed, I had gone through 9 tubes. So yeah, I'd gone through quite a lot of endoscopies, quite a lot of different changes of nasal jejunal tubes. And then I had my PEG-J placed in February of this year. From my understanding, and I could have this completely wrong, and again, it is different in different areas. My tube, if it stays okay, and doesn't get blocked or anything like that, or I don't bring it up or anything, my tube will stay in place for roughly around 12 to 18 months, I believe, before it's changed, because obviously there's only so long that you can have a tube in your system for, and obviously you have to be careful of fungal infections and mold developing in your tube. So I think it's roughly around 12 to 18 months that they can keep a tube in place, and then they have to change it for a new one. But I could be wrong, so don't come at me. Like I said, this is my first PEG-J, so I'm not really sure how often they change them. I've currently had this one in place for around 6-7 months now, and it's caused me nothing but grief and problems. But at the end of the day, it is keeping me alive, so I can't really complain too much. So the next question people tend to ask me is, do I put alcohol down my tube? Now, this is a grey area, again, because different tubes allow for different things. So I have a percutaneous endoscopic gastrostomy with jejunal extension tube, which basically means that I have a tube that goes through into my abdomen, into my stomach, and it has 2 ports. So I'm going to show you the ports. Hopefully you'll be able to see them, because yeah, I'm not really sure you can see. I'll show you. So this is my tube. So this white piece here is a percutaneous endoscopic gastrostomy tube. This goes through my abdomen into my stomach, and that's it. The one with the purple lid here does the exact same thing as this one here. However, it has the extension on it that goes into my small intestine. So where the white cap goes directly into my stomach, which allows for drainage and venting for when I feel nauseous, or if I've eaten or drank something that my stomach doesn't agree with, or, you know, on the odd occasions you can put medications down them. My one with the purple lid, which is a jejunal extension that goes through the gastric tube and follows on into my small intestine, so that I can be fed and given medication via that tube, which is then absorbed into my small intestine and gives me all the nutrients that I need. However, you may or may not have seen online certain people with the ones with the white lids, so like the percutaneous endoscopic gastrostomy tubes, or the PEG tubes, put in alcohol down their tube. Now, this is not advised in many areas because of risk to other organs. However, for somebody who has a stomach tube, so basically a tube that goes directly into the stomach, The digestion in your stomach works completely different to somebody's digestion in their small intestine. So everything that we consume orally will go into your stomach, and then the acids in your stomach will then break down those things and neutralize things, like alcohol, for example, and will then go through into your small intestine, where your body will absorb anything that may be good out of that. Not that there's much good out of alcohol, but you know, get my point. Like, say for example you've got a fruit in there or something like that, it'll absorb the good things, get rid of the bad. That's what your small intestine does. And it absorbs a lot quicker, and there's less acid in your small intestine than there is in your stomach. So when you take alcohol orally, or whether you take it through your gastric port, that is going directly into your stomach, the acid will help neutralize and break down that alcohol. However, because I have a PEG-J tube, which is basically a percutaneous endoscopic gastroscopy with jejunal extension, if I was to put alcohol down my purple capped tube, which is my jejunal tube that goes directly into my small intestine, my body would absorb the alcohol far too quickly. It wouldn't have been neutralized, and I'm putting myself at risk of organ failure. So I would put myself at risk of liver failure, kidney damage, maybe even intestinal issues, which I already have intestinal issues anyway, but not through putting alcohol down my tube. So yeah, it's not advised to put alcohol down any feeding tube. However, again, this is individual cases. This is individual to other people. However, it is absolutely, categorically, as far as I'm aware, absolutely forbidden for anyone to put alcohol down their jejunal tubes, whether it be a standard Jej tube, whether it be a NJ tube, whether it be a PEG-J tube. If you have a tube that goes into your small intestine and you put alcohol down that tube, you are setting yourself up for serious health consequences, and it is seriously not advised. I'm sure most doctors would probably advise that you do not put alcohol down a gastric tube either. However, again, it's each to their own individual standards. And if a doctor has said that it's okay for you to do that in small quantities if you choose to, then that is on you as a patient, as a person with a tube. But personally, I'm not somebody that drinks a lot of alcohol anyway. I have a heart condition, so I don't tend to drink a lot of alcohol. However, if I was to drink alcohol, I would try and take it orally if I could, and then drain it from my gastric port so that I don't get drunk, because I don't like being drunk. But I definitely would not ever put alcohol down my G port or my Jej port, especially not my Jej port, because it can cause serious long-term damage to your organs. This is not just me trying to scare people, like, this is actually truth. I have read about people that have done such a thing where they've put alcohol down the jejunal tubes and they've ended up in liver damage, liver failure, kidney failure, and things like that. So it is a highly unadvisable to put alcohol down a feeding tube. But like I said, gastric tubes are completely different, because gastric tubes go into your stomach and not your small intestine. So therefore the acid in your stomach would neutralize most of the alcohol, but because your bowel does not contain a lot of acid, then your small intestine would absorb. It's basically like someone putting pure alcohol in your bloodstream. It would literally damage you, especially if you did it on a regular basis, because your intestine absorbs alcohol a lot quicker than your stomach would allow your body to naturally absorb it. So yeah, I wouldn't advise alcohol in your bloodstream in a quick substance like that. So no, I don't put alcohol down my PEG-J tube. I don't put it down my gastric port. I don't put it down my jejunal port, especially not my my jejunal port, because digestion is a lot quicker through your intestine than it is through your stomach. And that's for everyone, not just for people with gastroparesis. alcohol is absorbed and neutralized by the acid in your stomach, where if it goes directly into your small intestine, it is not neutralized by the acid there, because there is very minimal acid in your small intestine. So yeah, that is it's a controversial question. I'm not gonna lie, it is a very controversial question, and I'll probably have people come in and attack me going, oh well, I put alcohol down my tube all the time. Like I said, at the end of the day, I can only speak from my personal circumstances and from what I've heard and read from other people's perspective with regarding to jejunal tubes. Like I said, I know a few people that do alcohol down the G tubes, which is the gastric tubes, which go directly into the stomach. But that is different than somebody putting it down the jejunal tube, because a jejunal tube, like I said, goes into the small intestine, where everything is absorbed in a quicker instant than something that is placed into the stomach, which is then neutralized and broken down more via the stomach acid. So if you have a PEG tube and with no jejunal extension that goes into your small intestine, and you're putting alcohol down your feeding tube, then that's up to you. But from what I know, it is highly advised not to place any alcohol whatsoever down a jejunal tube that goes into your small intestine, because it can cause severe consequences. So that is the answer to that question. What other questions do I have? I'm trying to remember these off my top of my head. These are the people that have asked me questions. I think another question was, what's the difference between a jejunal tube and a gastric tube? Like I said, a gastric tube will go through into your stomach, and a jejunal tube goes into your small intestine. So a PEG J and a PEG tube are similar tubes. However, a PEG J will have two ports, one of which will go into your stomach, the other one that will go into your small intestine, which I showed you a moment ago with the two different caps on my PEG tube. So yeah, that's the difference. You also get a standard J tube, which they'll just go straight into your small intestine, and you don't have an extra port on it that goes into your stomach. I don't have that tube. I was originally supposed to have had that tube, but we decided to go for the PEG J first. The reason for that was because even though I had an NJ that went directly from my nose into my small intestine, it was advised to go for a PEG J, because had I have gone straight for a jejunal tube and the jejunal tube was to fail, I would have nowhere else to go other than to go straight onto TPN or PN, which is perinatal, can't pronounce it, parenteral feeding, which basically is usually given via a central line that either goes through a PICC line in your arm, or a central line like a Hickman that goes into your chest and directly into your heart, which then is fed nutrients via your bloodstream. And obviously most hospitals want to avoid this, and most patients definitely want to avoid this, because of the fact that when you have a central line or any type of line where you're getting nutrients or fluids into it, you're putting yourself at high risk of sepsis, because things are going directly into your bloodstream, and everything has to be completely sterile. So yeah, you have to be really careful. So the way that doctors like to do feeding tubes is, providing your stomach works, they will go directly for an NG tube, which, like I said, goes from your nose directly into your stomach. If your stomach is partially paralyzed or just doesn't work very well, like mine doesn't, they will go for an NJ tube, which is a nasal jejunal tube, which bypasses your stomach and goes directly into your small intestine. And then eventually, if you need that long term, they will remove the nasal jejunal tubes or the nasal gastric tubes, and they will place a tube directly either into your stomach, which is a PEG tube known as a percutaneous endoscopic gastric tube, or they will place a PEG J tube because your stomach doesn't work, so it has to bypass that, where they will place a percutaneous endoscopic gastric tube with jejunal extension, which, like I showed you before, has two extensions, oh well, not two extensions but two ports on it, which again I will just show you here briefly. So like I said, this one here is my gastric tube, which goes directly into my stomach, which I use for venting and draining my stomach if I was to consume something that makes me feel sick or just in general feel a bit nauseous. And this one is the extension that basically goes into my small intestine, which is where I get all my nutrients and all of my feed and hydration into, and medication also. So yeah, but basically it looks like one tube. As you can see, it just looks like one whole tube, but this tube, this tube basically goes through this tube. So this tube goes through this tube and carries on into my small intestine, where this one stops with like a bumper about this big that stops it from basically being able to come out of my stomach. And this tube is known as a Frecker tube, which is basically has 2 lumens on the end. Because obviously I have to be fed into my small intestine, and because sometimes we just feel nauseous or bloated and get a lot of air, so we end up having to vent or drain the stomach to stop us from being sick. So that's why I have 2 ports. So yeah, I think that was all the questions. If I've missed any, I apologise. I'm trying to think. Oh, there was a couple more actually. The first one was that I can remember was, how many times do I have to flush my tube a day? Again, this varies from person to person and from team to team. Some people will flush their tube 4 times a day with 60ml syringes. Other people 6 times a day with 60ml syringes. I personally flush mine. I'm supposed to flush mine 10 times a day with 90ml. Which is quite a lot of fluid, and I can't always find the time to do it, but because of the fact that I have 800ml of feed, and the fact that I have trouble drinking fluid orally, I also have water that I can put on in between feeds if I'm having a day where I feel a little bit dehydrated, or if it's a really hot day and I'm starting to get a few dizzy spells, or if I'm unwell and I need additional fluids. I actually have water that I can also give myself through my my jejunal tube for my extension here, because I need the hydration and I physically cannot drink them. So yeah, I have water that way. So some days I will give myself a minimum of 6 flushes of 60ml, and then other days I will still flush, because obviously I have medication sometimes I have to put down my tube, but other times I will basically just put my water on, and my water will keep my tube flushed through anyway, because it's done with my pump. The gastric port, so the one that goes directly into my stomach, because it's 2 tubes in one, you still have to flush your gastric tube even if you don't use it. So this is supposed to be done once a week, but I'm a clean freak, so I do mine at least 2 or 3 times a week. Sometimes I try to do it daily, but again, because there's water going into my stomach, it can sometimes reflux and it's not a great situation, so I only do it roughly around 2 or 3 times a week. And the other question was, do I still eat while I have a feeding tube? Now, there is a misconception here with regarding people with feeding tubes that they can't eat and drink anything at all, and this is like a misconception that we also get at the hospital when you get admitted. They're like, oh, she has a feeding tube so she's nilled by mouth. That's absolute rubbish. Technically, people who have feeding tubes are still advised to eat what they can when they can, even if it's only like a soft diet or like porridge or something like that. They're still advised to eat foods for 2 reasons. One, because there's a social aspect of it, and obviously we still like to taste things. And 2, because if you don't use it, because your stomach is a muscle, so if you don't use it, you will lose it. So any function that we do have, in case there's ever a cure for gastroparesis, we're encouraged to still use that muscle and still allow the receptors from our brain to our stomach to let us know that we've eaten something. So we are advised to still eat and drink what we can orally, even if we can't digest it, even if we have to drain it, because that way our stomach still has that muscle memory to try and digest food if it can do. So yeah, like, we are still encouraged to eat. I've been in hospital a couple of times, and every time I've been, they've like, oh, she's on a feeding tube, she's nil by mouth, and I'm like, that's not how it works. Like, you can't expect someone to go into hospital and have no food and no water. You know, we still have to keep our mouth moisturized, we still have to brush our teeth, we still have to do all of these things. So you can't expect someone to sit there and not have a cup of tea, or not have a hot drink of any kind, or not sit there and taste food when you've got all of these people eating food around you. Yes, I may get all of my nutrition via my tube, but I would still like to participate in eating with other people. So yeah, the hospital even sometimes has a misconception that if someone is tube fed, then they don't really need to eat or drink anything. And that's rubbish. Obviously, after you've just had a procedure, fair enough. But the misconception is that we don't eat or drink anything, and we are supposed to. We're supposed to still be encouraged to do that, regardless of whether it makes us feel sick, and whether we have to drain it, whether we have to have bent our stomach, regardless of what the situation is behind after we've finished eating or drinking. We still are encouraged to do it. Even if it's like only 2 mouthfuls, we are encouraged to do it. Because like I said, your stomach is a muscle, and if you don't use your muscles, then you will lose them. So yeah, I think that's pretty much all of the questions. Thank you so much for watching. If I have offended anyone, especially with the alcohol question, I apologize. I'm just letting you know my personal experiences and what I've learned from having a feeding tube, and what the pros and cons are for doing the alcohol situation. Like I said, I can only talk from my own experience. I'm not a medical professional. If you and your team are happy for you to put alcohol down your gastric port, then that's fine. But obviously, like I said, I don't think any doctor or any physician would advise for anyone to put alcohol down a jejunal extension or a jej tube, because like I said, your body will absorb it far too quickly, and it can cause serious consequences. Like I said before, gastric tubes are completely different. Obviously it's probably still not advised, but you know, I can't talk for other people. I don't personally do it because I don't drink alcohol. So yeah, I apologize if that question offended anyone. I'm just answering it the best of my ability. Like I said, I'm not a medical professional. I'm just talking from my experience. But thank you so much for watching. I hope this has answered a few questions that people have wondered. If you have any more, please drop them to me either below, or you can DM me on my Instagram. I'll be happy to answer them. Again, sorry if I've offended anyone. Please don't come at me. And as always, thank you so much for watching, and I hope to speak to you again soon. And yeah, take care, and hopefully the weather will improve slightly, but we are backing into winter now. So yeah, I hope you enjoy the autumn and snuggling in front of the fires, and you know, it's never too early to put your heating on if you're cold. So look after yourself, guys, and thank you so much for your kindness and your patience, and I love you lots.